Hello, good evening to all those who have. Hello, everyone, and welcome to today's webinar, Career as a Dentist. Thank you for taking your time out and being here today. My name is Snehal. I'm a senior counselor at Era Foundation, Bangalore, and I'm excited to be hosting this session today for you all. I'm pleased to introduce to you all today's speaker, Dr. Lakshmi Prabha, and today she's going to talk to us about the career opportunities and challenges in the field of dentistry. Today, many of the students dream about a career in the lucrative field of medicine and healthcare. But the question is, how does one get there? This session will help you all understand the details about a career in the field of dentistry. She will cover various facets and career options available after the completion of BDS degree. So let me introduce to you all Dr. Lakshmi Prabha. Dr. Lakshmi Prabha graduated in the year 2004 from Sri Ramachandra Dental and Medical College, Chennai, and she began her dental career with Colgate as visiting doctor to do oral health checkup for various corporates and organizations. Later, she got opportunities to work as an associate doctor with many legendary dental experts, and she learned from them about the latest advancements in the field. She also worked as a lecturer in pediatric dentistry at Satyabhama University Dental College and Hospital, Chennai. She was later appointed as in-charge doctor from 2016, and this opportunity gave her possibilities to prove her talents. The best quote she follows is, "Miracles happen when we believe it will happen." I welcome you, Dr. Lakshmi Prabha, on behalf of the entire team at Era Foundation, Bangalore. So I welcome all the participants who have joined us today. We hope that this will be a fruitful session for all the students, parents, teachers, and counselors who have joined us. If you have any questions during the webinar, please type them into the chat box. We will have time for question and answers at the end of the session. Sit back and gain as much information as possible from this session. I welcome you, Dr. Lakshmi Prabha.
Yeah, thank you.
So my first question to you, Dr. Lakshmi, is could you just give us a brief about yourself?
So I'm a full-time clinician working in Chennai for close to 2 decades, and I'm working as a dentist in a renowned corporate sector. So I practice general dentistry on the whole. So my childhood ambition is to become doctor and touching human lives and do wonders. So I'm a self-motivated and self-made woman. That's it.
Okay, that's great to know. That's great to know, Dr. Lakshmi Prabha. Okay, before we move on with several other questions, I just have a poll for you all today. So look at your screens and respond to the polls. Just want to understand, are students from science stream here, or are you students from commerce or arts stream? I'll just give you all like few seconds, 15 seconds or 20 seconds to just respond to the question. Okay. I guess most of you have answered. Thank you so much. So we have 66% of people from science stream and 33 of them from commerce or arts stream. Okay. So my next question to you, Dr. Lakshmi Prabha, is what is the actual role of dentist? What do they do?
So basically, dentists are doctors who specialize in oral health. They provide oral health guidance and instructions to patients, carrying out preventive and restorative care. They treat a variety of diseases affecting not only the teeth, but the gums and the mouth as a whole.
Okay. My another question to you is, in order to become a dentist, as most of our audience are students, what are the educational requirements for this job, or what is the career path for this field? What should students study?
So to get into this, you have to pass 10th and plus 2 with physics, chemistry, and biology, and to apply for competitive entrance examinations. It's simple.
Okay. So, what kind of competitive entrance exams do students have to write for this? Apart, is it just NEET or
Yes,
anything?
yes. They have to write NEET, that is National Eligibility Entrance Test,
Hmm?
and for BDS.
Hmm?
So they have to study obviously the plus one, plus two, and they need to apply online the application process, and the fees would be like around 2,000 to 3,000, and
Okay.
the cutoff mark every year it varies. It's only the
Okay.
government decides.
Okay. So students have to take up physics, chemistry, and biology, and they have to apply for NEET and get into this.
Correct.
So uh, they get placed in dental colleges. And can you just give us an idea of which are some of the top institutes or top colleges in India which offer BDS course?
Fine. There are many dental colleges overall, but to mention few, or like to say like top in Chennai, I would say like Government Dental College. When it comes private, I would suggest Savita and Sri Ramachandra, because they are renowned for a very long time, for more than like around 30 years, close to 30 years. And Jipmer in Pondicherry, it's good.
Okay.
And the first dental college would be the Kolkata Dental College, Government College. And apart from that, Manipal, you have like A.B. Shetty College in Mangalore, and Babuji in Davangere. So all these are renowned and top colleges, to name few.
Okay. So when we talk about colleges, students also would like to understand what is like the approximate fees for this particular course. So, what exactly? How does the private and private dental colleges and the government dental colleges differ? Approximately, what is the fees range if a student wants to get into a private college?
Private college, probably it would range between 5 to 10 lakhs per year.
Okay, okay, okay. So, 5 to 10 lakhs is the approximate course fee for one particular year in private dental colleges. So,
Yeah.
could you just give us a short course structure about BDS? Is this a 4 year course, 5 year course, and how is the course like? How does it
So,
differ?
it is a 5 year course in which 4 years it will be full of clinicals, and 1 year it's the internship which they have
Okay,
to do. So the first 3 years, whatever MBBS studies, even they have to study like basic sciences,
okay,
and every year they will have one dental subjects. In the
okay,
final year, fourth year, they will have like 7 papers, which is full of dentistry.
okay. And do students, after pursuing BDS, do they go ahead and do masters, or can they just practice with just the BDS degree? Is it important to do masters?
Yeah, it's a additional advantage
Okay.
doing post graduation, and if they are interested in academics, then obviously they should have masters.
Mhm.
So the student has to decide whether they wanted to become a full time clinician, or like they wanted to teach.
Okay.
So that plays a major criteria to decide whether to do MDS or not. Otherwise, BDS is more than sufficient. After finishing BDS, they can take up like short courses, like 1 month course or 2 month course in different specialities, and they can upgrade their skill, and they can start their own practice. So it's not like 100% mandatory where they have to do MDS
Okay. So these
unless and until it demands.
okay. So these 1 month courses, are they available in the regular dental colleges, or do students have to look out for different institutes?
No, they are not available in colleges. Senior practitioners who have been practicing for a very long time, they do
Okay.
conduct courses which are really helpful and beneficial, where they can pick up very fast. Actually, I would say like during your college days, that is the 5 year course, we
Hmm.
are more oriented towards passing exam. So when it comes to medicine, the actual learning starts the moment you step out of the college,
Correct. Correct.
because your mind
So
is, yeah.
yeah. So, in terms with regard to the internship, does college help students with internship, or students have to choose where they want to intern, and how does the internship process go on? The 1 year internship in the course.
It would be on the same college itself, unless and until for some specific reason, if they are going to shift to some other place or anything, then it's a bit tedious process where you are like to do a internship in somewhere else. So most of 99% of the students, they'll finish their internship in the same college.
Okay, are these internships paid opportunities, or are they unpaid internships?
It depends on the college. So in
Okay,
government college, it is paid, and few of the private colleges also it's paid. And it is not a big amount; it is a very very small amount.
okay, okay,
So
okay,
once they finish 5 year course, there is something called senior internship programs, which is
okay,
available in government sector, which they have to apply online. And if there is vacancy, they will call, because the seats are very very less. It's like only 1 or 2 seats.
okay.
So depending on the vacancy, they will call, and it's a 6 month course. Even a student who finished in private college also can apply.
Okay, so is there any portal that students need to be aware of to apply for this particular senior internship program? Any
It's
government portal, or where is it usually advertised?
no, it's advertised in website, or they can directly contact their seniors and then they'll guide them. So
Okay,
that's not a big thing. Yeah.
okay, okay, okay. So now that we have some clarity about the course BDS and the internship program, let us try and understand what are some of the early roles in this field. As soon as they finish internship, what are some opportunities or job roles that students can get into?
Fine. Earlier, I mean, roles would be like a junior dentist working under a senior practitioner, or you can be like a passive observer, and
Okay.
obviously dental assistant. So initial 1 year, it would be like you are under a supervision of a senior doctor. That's how it goes actually. But most of the students these days, from first year itself, as a part time, they go visit dentists. They go like once a week or twice a week, so that they get used to like things like how the clinic runs and how they handle patient. So most of the current students, they are like aware. So during my days, I joined only like in my 5th year, that is during my internship. But these
Mhm.
days, like, from the first year itself, they are aware like as there is like too many dental clinics, so they
Mhm.
just go and help and then observe and get to know things, and they get familiarized. So these are the early roles in the field.
So, what is the remuneration that students can expect in these early roles, like the salary range that they get, a minimum salary criteria?
Those who finished, or like
Once they get into these early roles, like junior assistants or observers.
so it ranges between like 5,000 to 10,000 per month.
Okay, okay. So, do even reputed hospitals recruit for fresh graduates in BDS?
Yes, yes. For freshers, it's open everywhere.
Okay, okay, okay. That's great to know. So, could you give us some information or describe as to what is your usual work day like, or your daily routine, and what are some of the key responsibilities that you take up every day as a dentist?
So basically, it's diagnosing oral diseases, promoting oral health and disease prevention, and uh, creating treatment plans, interpreting X-rays and diagnostic tests, follow-ups, and performing various dental procedures, record maintenance, review calls.
Okay,
So these are some basic responsibilities which we do every day.
okay. And what is the timings that you usually work in a normal day?
So it differs from dentist to dentist, but
Okay.
most of the dentists, they work like full time, that is like 7 to 10 hours per day, except when emergency arises, which can occasionally lengthen the work day. Mostly, I work full time, all days, 365 days, unless and until whenever I feel tired, I take off.
Okay.
So, or some dentists default they take off on Sundays. So, when it comes to our profession, the nicest thing is the flexibility in our schedule, so
Yeah.
you can have your own time and
Correct.
practice. Some work only like evenings, morning they work in college, so they open clinic only in evenings.
Okay.
So so it's flexible.
Okay. So suppose somebody wants to get into the field of teaching in BDS, what is the path for that?
Pardon?
If somebody wants to get into the field of teaching in dentistry, what is the path for that?
Okay, they have to directly apply in college. They have to just submit their resume, and if there is vacancy, they'll call you for interview. But it's mandatory now that only if you have MDS, you can apply.
MDS. Okay.
Correct,
Only
MDS,
MDS.
and most of the colleges are full
Okay. Okay.
in
So
Tamil
there
Nadu.
are very limited opportunities for teaching.
Yes, very very limited opportunities for teaching. Yes.
Okay. So apart from just the dental role, I mean just the role as dentist, what are some other job roles that's available in the field of dentistry?
Like dental hygienist, dental assistant, lab technician.
Okay.
So
Could you
these
just
are.
give a brief about what they do, their job role?
So dental hygienist basically they sterilize instruments. They'll arrange prior to the any dental procedure. They arrange instruments. They help the dentist by holding suction. So these are the basic thing which dental hygienists do. So dental lab technician is someone who fabricates dentures, prepares crowns. So there are courses available for this also, which is like upcoming.
Okay.
So as of now in Savita, it is available. It is like 2 year course, lab technician course, where they teach everything and then they can start their own lab.
Okay. 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 So to all the participants who have joined us, I have one more poll question coming up for you on your screen. Just look at your screen and give your responses. Just want to get to know all of you as to who's joined us and which background are you from. I'll give you all like few seconds to respond to the poll. Okay. So thank you all. We have 66% of students who have joined us today, and 33% are parents or teachers who are interested to know about the field of dentistry. Okay. So my next question to Dr. Lakshmi Prabha is, uh, what are some of the experience that best prepared you for this job role? You have 17 years of experience.
Yeah.
So what are some of the experiences that has prepared you for this particular role as on today?
Yeah. So I was working under my HOD for like almost 3 years,
Okay.
which helped me to learn everything. Not only like diagnosis or like interpreting X-rays. Apart from that, how to talk, because all these things they won't teach in college. You will learn it only outside, like your communication skill, listening skill, how to handle feedbacks, and how to do business basically,
Okay.
because we are too young, right? 21, 22. So all this helped me to learn how to run a efficient and effective practice alone.
Okay.
Right. So I would suggest like the moment you finish, it's better you work under someone and learn all the skills,
Okay.
because anybody can do treatment. I mean, you can call a consultant and finish off the treatment, but to run a practice, it is mandatory. It is a must. At least 1 year You work under a senior practitioner and make yourself motivated and learn everything. Because medicine profession on the whole, you can only practice. Nobody can master. Even at 60-year dentist, the first impression can be wrong. I mean, the dental impression. Fine. So you have to like learn, unlearn, and learn. So I would suggest like it's better to work under someone at least for a year or two, and then you can start your own practice. So that by the time you'll develop some confidence also to run things effectively.
So now that you spoke about private practice or your own practice, what are some requirements for students to begin their private practice? Is there any license required or any other certifications that's required to start on their own?
So, so apart from your registration from Tamil Nadu government, for example, if you're doing in Tamil Nadu, your college, then you need to register. You need to get your license. Fine.
Okay.
So the moment you finish, they will give you from college. They'll give you transfer certificates and other certificates. With that, you need to apply for that. So the
Okay.
college doesn't guide in that. So you need to get help from your seniors or like other dental practitioners, and then you need to apply for your license first.
Okay.
Fine. So once you get the license, you can start your own practice if you want to. Fine. So after that, once you start your practice, you have to again license your clinic.
Okay.
Same. So it is all available in the website, Tamil Nadu Dental Council, for your
Okay.
board, everything. And there are few things which mandatory you should have, the waste disposal and fire extinguisher. So there are a lot of things which you have to do one by one.
Okay. So this is for Tamil Nadu. If is there anything in common for the entire country? Any licensing body or any association for dentists or dental practice?
That is IDA, Indian Dental Association, where you
Okay.
need to register into that. That's it.
Okay.
And every state has its own body, so
Okay.
you need to register there. That's it.
So if in case I want to practice in any other state, I have to register with that state body.
Correct.
Okay.
Exactly.
So IDA just is a normal registration. But if
Yes.
I have to practice in Bangalore, I have to register with the Karnataka
Karnataka.
body or
Yes. And
Mumbai.
their rules and regulations differ from Tamil
Okay.
Nadu.
Okay. So state to state rules and regulations differ with regard to licensing.
Yes.
Okay. Okay. So now that you've been practicing for 16, 17 years, what is the favorite part about the job that you do? What do you enjoy the most?
So it's basically you treat your fellow human beings, simple, first thing. And it's all about building relationships and flexible working hours, a decent income. And more than anything, there is nothing better than changing the life of a patient who is no longer embarrassed or ashamed of her smile. That's it.
Okay. Okay. That's great to know. Yeah. I have one more poll coming up for all the attendees now. Just look at your screens and answer the poll. So my question to you all is, how many of you are interested in becoming a dentist? From all the attendees we have today, how many of you are interested in becoming a dentist? I'll give you all a few more seconds to respond to this question. Okay. So we have the results. 50% of them are interested in becoming a dentist. This question is not applicable for 10% of you all, and 40% of them are not interested. Maybe they are parents or their teachers who are just here for information. Okay. Thank you all. I would just like to tell you all one more thing. While we are discussing and talking about this field, if there is any question that you want to ask Dr. Lakshmi Prabha, or if there is anything that you want to know more than what we are talking here, please put it in the chat box so that we can address your questions also. Okay. My next question to you, Dr. Lakshmi Prabha, is can you share your personal journey on what exactly motivated you to become a dentist?
Okay. So first thing would be like to be independent and earn decent amount of salary and flexible lifestyle. And you have the opportunity to start your own business right after the dental school. So this gives a lot of independence and allow to set our own business and career goals. And apart from that, you'll be respected members in the community. So these are the three things which come
That
into mind.
motivates.
Yeah.
One is financial independence, one is respect, and one is the that you want to help others, other human beings.
Yes.
That's great. That's great. Yeah.
I mean, if you don't like people or if you don't want to help people, then better don't join. You won't enjoy medicine.
Okay. Okay. That's again one more thing to keep in mind. Yeah.
Yes, yes, yes.
Okay. So, as we have majority of the students who have joined us, would you like to tell them as to what are some of the biggest challenges that you face day to day or day in and day out with regard to your profession? What are some things that they should be careful about?
So the biggest challenge I would say is acquiring new patients.
Okay.
Just because there is very less awareness, dental awareness. So people just ignore. It's not that nobody has dental problem. It's unfortunately we have 32 teeth. If we have like one heart, one teeth, then people will come immediately. Just because it's 32, it's taken for granted. Fine. So in India, around 2 or 3% only visit dentist. So with that only the dentists are surviving. So if everybody have the awareness and once they start visiting dentists, then the number of dentists is like very, very low. So we say now it's saturated. Actually, it won't be in
Okay.
that way. Yeah. So the
So,
biggest challenge I would say is acquiring new patient. But to overcome, you have to promote yourself. You have to upgrade your skill. You have to do your continuing dental education. You have to do marketing, digital marketing, social media, and at the end of the day, when it comes to medicine, it's word of mouth.
yeah,
Fine. If you have 100 families, that's it. Your success.
correct, correct. That's true. That's true. Okay. So my next question to you is, what is something that you wish you had known before you were starting this career or before you were getting into this particular role? If you had to know something about the field, what would it be?
I wish
Something.
I wish I would have known this international learning communities for upgradation of advanced technical knowledge. That is the
Okay.
only thing. Rest everything seems to be okay.
Okay. So now that you're talking about international communities, do students who are practicing or aspiring students have access to it? How do they get to know about communities like that?
Right now, Facebook has a lot of communities where they keep posting worldwide and Instagram, and that's more than enough. I mean, 15 years before, we didn't have access to all those things. So these days, students learn from YouTube because
Correct.
there are, yeah. So I mean, they don't even they skip classes and learn. There are a lot of good teachers like who post videos and I mean internationally where it's we come to know like what they are doing, how it differs from here and there, and how they practice, how they handle patients. So yes, so now
Oh,
it's like it's an easy access.
okay. Okay. Yeah. Thank you. Now that we're talking about BDS or different medical courses, most of them, when students are studying medicine, they usually tell their teachers or parents that the syllabus is vast, subject is vast, and there is lot of there is a lot of confusion with related to the subject matter. and they are finding it difficult to study, or they have to prepare a lot for their exams. So what are some of the study tips that you would like to give to students who are in the medicine field, or who students who are studying for BDS or practicing, or they're studying for different fields? Dr. Lakshmi Prabha, I think you're on mute. Yeah.
Yeah. So, I mean, for 12 students or like someone who's
Who's,
studying this,
who's into BDS?
okay, studying tips, I would suggest like uh, generally when we study, our teacher itself will say these are the important questions. Just study only that. That's enough. Fine. You don't have to study the whole 1,000 pages. Not required.
Okay.
Simple. It's as simple as that. Because
Okay.
I remember after I finished my first year exam, I told my mother that I will fail. But once I got the result, everything was cleared. Then I understood. So you have, because in 10th and 12th, we are trained to study every line. I mean, they would have mugged up the entire book. So it doesn't work that way once you join college. So the teachers will tell you what all the important thing which you have to know as a dentist. So if you study only that, for sure you can clear the exam and you don't have to take that pressure.
Okay. Okay. Yeah. So I hope this tip helps all the students who have joined us. Okay. My one more question to you is, in the last 1 year, we have seen the COVID pandemic and how it's affected a lot of people and a lot of professions. So how has that affected the profession of dentists, and how did dentists go digital, or how did they do their consultation online? Because you have to meet your patients in real and examine, because you're looking at oral health, their dental hygiene and all. So how did dentists find it challenging, and how did they cope with this particular COVID situation?
Many dentists were practicing actually with following all the protocols, and apart from that, mostly we were doing telemedicine.
Okay.
Fine. So we just over the phone we inquire, we take the history, what are their complaints, and then right now we have like WhatsApp and other digital media where they can take pictures of their teeth and they share it to us, and then accordingly we were treating through medicine itself, because 50% of the problem with the tablets itself will get controlled. So even after taking the medicine, still if the patient complains of pain and discomfort, then we call them and then we treat them.
Okay.
So it was going okay.
Okay. Okay. So, for students who are aspiring to get into the field of dentistry, what are some of the skills you think that are most important for a student who's interested in a job like yours?
First, I would say negotiation skills, meaning like they should have effective verbal communication, listening, speaking, so that it reduces misunderstanding. So we are taking case history, right? So we are asking the patient to talk. So you should have the patience to listen first, and then you have to communicate in such a way the patient understand what is the exact problem, and you need to convince them for treatment plan. So for that you need excellent communication skill, but over the time you will learn it. You should have the confidence, you should not feel low, because in Tamil Nadu, I mean in Chennai, most of the patients they speak English actually rather Tamil. So you have to be fluent in your language. Plus, it's added advantage if you know one or two languages extra, because there's nothing comes like when you talk in mother tongue. So the conversion rate is very high. The second I would say is manual dexterity, meaning like hand skill, because it's purely like art.
Yeah.
So it would be an added advantage. It doesn't mean it's mandatory, but over the time you can build, because I, many times I have analyzed why, how come I've become a dentist, because I don't have any skill. But then I learned So I developed the interest and I learned. But it would be an added advantage if you have skill, like if you are doing some soap carving, all this, it will
Okay.
help. And apart from that, organizational skill like goal setting, meeting the goals, and making schedules. So these are some primary skill which is required
Okay.
in the field of medicine on the whole.
Yeah. Okay. Yeah. So, yeah, thank you so much for that answer. And for students or for professionals who are in this particular field, what are some of the professional journals or what are some of the professional organizations that they need to be aware of?
So the first thing would be the Journal of Indian Dental Association, what we call it as JIDA.
Okay.
So, so they conduct regular programs for continuing dental education because you need to acquire certain CD points every year to renew your license and to
Okay.
upgrade your knowledge. And apart from that, you can international dental journals would be like British Dental Journal and American Dental Journal. So that's it.
Okay. These are some of the journals. Okay.
Yes.
So apart from these journals and all of that, if students want to regularly stay updated, apart from the resources that's available from the journals, is there any particular website which is specific to dentistry or anything of that sort that students can look into for more information?
More than website, I would say like there is continuous conferences happening. If they are able to like register and uh,
Attend.
attend, it would be great where they will learn the new skills and new technology and instruments, everything. Because we use a lot of equipments. So and the equipments it keep updating every year, new ones. So where they can learn.
Okay. So, while you're talking about conferences and all of that, so do students also have opportunity to present research papers in this conference with regard to dentistry, or it is just qualified professionals?
Yes, they whether it's BDS or MDS, they can submit, and if they are shortlisted, they'll be invited.
Okay, okay, okay. That's great to know. So, as we know, careers keep changing and advancing, new technologies keep coming up. So, in the field of dentistry, what are some of the changes that you have seen in the last decade, last 5 to 10 years, and what are some of the changes that you're expecting could happen in the field of dentistry in the next 5 or 10 years for students to be prepared or for them to be aware of? What are the changes in the job role? Or what is coming up new in this field?
Okay. So in future, there is a very high chance of something called bridging course with MBBS.
Bridging.
Yes, bridge course, which
Okay.
can happen. And second thing is there is a possibility where the government can bring dental insurance in India.
Okay.
So fine, though there are a lot of patients who are interested in treatment but not affordable.
Okay.
Right? We do have medical insurance, but there's no dental insurance in India. So there is a very high chance where dental insurance can come up in future. So the opportunity for dentists will be high.
Okay. So that's something that's coming up. Apart from this, do you see any change in job role? The kind of responsibilities that you're taking up now? Do you think different machines, we see that AI and different artificial intelligence technologies are growing? Do you see a lot of machines getting involved in dental care and reduction of work on doctors or assistants?
You don't have to worry about that because when it comes to medicine, I mean dental, I don't think nobody can beat. Only
Okay.
human hands.
Only human hands. Okay.
At least for next 50 years, guaranteed.
Okay. So students do not have to worry about the profession going extinct. Okay.
Yes, yes, not at all, not at all.
Okay.
And
So
no Ayurveda or Siddha will help for dentistry, only allopathy. So you don't have to worry about that also.
okay. 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 So, what would you recommend to students? There are paid employment opportunities and there are internships as well after they finish their BDS degree. What would you recommend to students for them to go ahead and take up the paid employment opportunities or the internships to learn more and to get a more experience, practical experience and exposure?
They can apply for senior internship in government colleges. They can apply through online, and if there's vacancy, they can do it. It's a 6 month course where they get to develop skills,
Okay,
extractions, fillings, root canals. So they'll get trained. It will be a benefit for them to start their practice, their own practice, because they'll develop confidence, because they'll be doing like in 6 months time, they would have done like around 400 extractions. So
okay,
they'll be well versed. Fine.
okay,
And apart from that, they can do post graduation followed by super specialty.
okay, okay. So, you recommend senior internships for students after their BDS.
Yeah. Yes.
Okay. Apart from all that we have discussed, what is some most important advice that you would like to give to students who are starting this field or who are in this particular field?
Okay. So the first advice would be like, you must not, you should not join medicine for money, status, family pressure. You should join only if you want to help people, because as I told you before, you will never be happy in medicine if you don't like people or if you want to help them, because it is a service industry. Fine, it is
Yeah,
not a business industry. So
correct.
money will come, you have to patiently wait. It is not like corporate job. The moment you finish, you won't get a lump sum amount. As you
Yeah,
get older and older, I mean, your value will go higher and higher. So
yeah,
you have to have that patience. Fine. And second thing is, do not lie. Tell the truth. Any day your patients can forgive your mistakes, they cannot forgive your lies and cover up. So admit your mistakes and apologize, because you can earn money, but reputation and trust should never suffer because of it. So that is the thing which I want to do. No malpractice, unethical practice. So never go with the mindset that if you become a doctor you'll become rich. No, basically doctors are selling only trust. One
yeah,
patient walks in, and they're not going to ask you, show me your certificate or anything. They just blindly believe you, and you recommend a treatment and they accept. So basically what you're selling trust. So that should never get spoiled. So that is the oath which you have to take. I mean, not to everybody, within yourself you have to take that, and protect yourself from all the professional diseases. That's it.
okay,
Health, your health is very important, so you need to
correct,
protect. Yeah.
correct. Yeah. So apart from all of this, there are dentists and there are some doctors who practice in a hospital and they practice in the clinic as well. They practice in two, three different places. So how do these people manage their time, or how do they get different opportunities?
Yeah, if you, I mean, if you want to make more money and if you have the skill, then they go as a visiting consultants to different clinics. There are friends of mine who travel to different state, other cities also in
Okay,
weekends, just to
okay,
make a little extra money. But it is not a must. You can have your own single practice, one chair practice, and then you can slowly build up also.
okay,
Any dental practice, it will take like 3 to 5 years for a stable to get stable, and then there's no downward road.
okay. That's great. So, if you have to give some oral tips or dental hygiene tips to all the attendees who have joined us, some simple tips that they can follow, what would be the main tips that you would like to give them?
As everybody says, brushing 2 times, I would suggest before you go to bed, please brush, because your salivary secretion is low. That is the reason why we ask you to brush at night. It's okay if you don't brush in the morning, because you will eat, you drink, so that natural cleansing will happen. So morning brushing is for others. Night brushing is for your dental health. Fine,
Okay.
so that is the first tip. Second tip is like avoid all junk food, processed food, refined foods, or chocolates, anything sweet. I mean, if you're going to eat on a daily basis, then there is a high chance where you tend to develop cavities. So after eating, you make sure you rinse your mouth or eat anything raw food, cucumber, apple, or beetroot, so that it just flushes off, so that you don't have to suffer with cavities. And very important thing is like your first dental checkup is 6 months
Hmm.
when you're born. So
Okay.
from that day, every 6 months you have to get a dental checkup done, because you don't have to suffer at all. Because everybody visit dentist only when they get pain, where the damage is more, the treatment is also extensive, and the price also will be high.
Okay.
So at least once a year or once in 6 months, you have to get a checkup done.
Okay. Yeah.
These are some basic, simple tips.
Oh, yeah. So, thank you, Dr. Lakshmi Prabha, for those tips. My one more question to you is, how does international degrees or international once a student goes abroad after their 12th, if a student goes abroad to study, can they come back to India and practice? Is the degree relevant? What they hold the international degree from abroad, is it relevant in Indian scenario? Can they practice in India with that degree?
They can practice provided they give the exam and get the license, and they have to do the internship also.
Okay. So,
If it
is
is
there
masters, if they are going for masters, they can put MDS, but they cannot work in college.
okay?
They cannot enter into academics. Only very few MDS degrees are recognized by the Tamil Nadu Dental Council.
Okay. So, if they go ahead, go to some other country for their bachelor's degree in dental or dentistry, and come back to India, is it relevant?
Yes, they have to give the exams. They
So,
have to give
what is the common exam that they have to give? Is there
uh,
any particular exam?
license exam.
Okay.
So in India, so they have to give the license exam, and after that they have to do 1 year internship, and
Okay.
then the they have to register in their own state, and then they'll get the license.
Okay. Yeah. Oh, yeah. Thank you so much. So, with this, I come to the end of my questions, and I hope we have all gained a lot of information about dentistry. Thank you, Dr. Lakshmi Prabha. We enjoyed hearing about your current and previous positions and all the valuable advice you have given to students about the field of dentistry. So, now we will go ahead and take some time for questions. Just a reminder, please be sure to type your questions in the chat box. We will have it answered by Dr. Lakshmi. For all the attendees who are out here, if you have any questions, please post it in the chat box and we will have it answered. Anything related to career opportunities in dentistry, to anything about the field, you could post it in the chat box and we will get it answered by Dr. Lakshmi Prabha. I don't see any questions coming in. Was it quite simple and to elaborate that you have all the information? Anyone? Any questions? I will just wait for a few seconds. Does anyone have any questions with regard to the field of dentistry? Anything that you would like to know in specific, apart from all that we have covered? Okay, we have one question, Dr. Lakshmi Prabha. Jitendra Reddy asks, which is the best country to study dentistry?
Which is the best?
Country to study dentistry.
Uh, USA,
Oh,
and then you can settle there.
okay. So why USA? Is it because of the advanced courses that they have, or any particular reason?
Yeah, they have everything upgraded, and they have all the latest technology, equipments, and staff, and it's very pricey also.
Okay.
So most of the students who do there, they never turn back.
Okay. Any idea or any information you know about the courses in USA, the fee range, or some of the name of the colleges?
Oh, actually, it's a very tedious process. So during your third year, I mean, once you finish your 10th and 12th, you need to
Hmm.
give up exam over there, TOEFL and other exams, and then you need to apply for colleges. Once, if you're shortlisted, then they'll call you for interview. Fine.
Okay.
And if you pass through the interview, then you can join the college. And most of the time, they apply for loans. You cannot pay it from your pocket because it's
Right.
too pricey.
Educational loan.
Yes, yes. And generally, how students go is like they do the BDS course here in India as it's very cheap. And during their third year, they'll start preparing for the exam, NBD,
Hmm.
called
Okay.
NBDE. Fine. So they apply for that and they give the exam. Once they get cleared, now it became an integrated course. Previously, they had like part one, part two. Now they have integrated from 2020. So it's
Okay.
like only one exam where they need to clear the exam. Fine. And then they have to go to dental school again. Just
Okay.
because you have finished your course here, 5 year course here, you have to do that only for 2 years or 3 years, which is very economical and it's very easy also.
Okay.
But if you're going to apply directly from 12, the chances of getting through the college is very hard, because there will be a question raised that when you have so many colleges in your country, why is that you're applying here? So unless and until you give a relevant answer or something very, very specific, I mean, most of the time your application process will be rejected. But once you finish your course here and then you apply, I mean, only visa would be the problem. If you have
Correct.
a visa, then it's easy. You can go straight away and then do the course 2 year or 3 year. That differs from college to college. Few colleges will have 2 years, few will have 3 years. Finish that, get your license, and then you can start your practice.
Okay. Okay.
It's a
That's good.
very tedious process, actually.
Yeah. Correct. So his question is, can he go after 10 plus 2? Yes, you like Dr. Lakshmi Prabha said, after 10 plus 2, you have to prepare for TOEFL exams, and then you have to look into colleges, their eligibility criteria, your loans should get sanctioned. So it is a lengthy process. Getting in touch with different career consultants or different agencies for admission process will help you get into colleges there. So I hope your question is answered, Jitendra. Okay. My one more question to you, Dr. Lakshmi Prabha, is you have some experience in the field of pediatric dentistry, correct? For students who are aspiring to get into the field of pediatric dentistry, as children are mostly when they come to clinics, they have different tantrums or they are not open. Like adults, they do not follow instructions. So, what are some tips for people pursuing pediatric dentistry?
Fine. So don't push them. So the first dental visit will be only like communication, being friendly with them, and it's more of talking only. Don't try to do any treatment in the first dental visit.
Hmm?
So let them get used to it. Let the child get used to it, what they are doing. They are observing everything, and you can ask them to use it and feel it and see. And you have to use a different name for them. I mean,
Okay.
for example, you cannot say suction. You have to say it's a straw. It will remove all the water. So all these words, everything you will learn during your college days. So it will be easy. Because the first visit itself, if you do any treatment and if it gets fixed in the child's brain that dentist is painful, I won't visit dentist till end of his or her life, it will be there. They'll be scared of dentists. That's why many adults, when they say I'm scared of dentists, it's because of their childhood experience. So take it slow, and more than giving advice for the doctor, I would suggest parents don't tell them anything. Just bring them blindly. You bring them, and doctor will take care. Because
Okay.
most of the time at home they will say they'll do this, that, and automatically they tend to develop fear.
Correct,
Yeah.
correct, correct. Okay, yeah, that's good to know. Any questions? Anyone else has any questions with regard to the field of dentistry? We have 3 more minutes before we close. If you have any questions, you can put it in the chat box and we will have it answered. So, like we have different job portals for different corporate positions and different organizations, how are dentists aware of job opportunities? Do you have tie-up with hospitals or your colleagues send you about job opportunities? How do students have to look for new job opportunities?
They can use Indeed.
Indeed, okay. Indeed also has information.
Yes.
Indeed, LinkedIn, any portal gives information about
Indeed
these.
is very common than LinkedIn.
Okay, okay.
Yeah.
Uh, Apart
And
from that,
apart from that, directly they can call up the clinic and they can inquire whether there
okay.
are any vacancies.
But with regard to the government positions or government dental hospitals, if they have to apply, is there any different procedure, any exams that they have to go through?
Yes, they have to register. The moment they get the license, they need to register in the government. So, and government has their own exams too for job. So they can apply, and if they are shortlisted, they'll get.
Okay,
Otherwise, it's a waiting game.
okay. So for government roles, there is again a lot of competition, and they have to register and they have to wait. Okay. Okay. Do we have any other question? Anybody else has any other question? Okay. My last question to you would be, Dr. Lakshmi Prabha. Most of them are aware of dental issues like teeth staining, and cavity sensitivity. These are some of the common dental problems or issues that, as common people, we are aware of all of these. What are some of the drastic issues or problems that could really cause them a lot of harm when it comes to oral health and hygiene?
Yeah. Irregular teeth, crowding, or procrastination, which can subsequently cause decay and gum disease. So it's better to get it aligned. Second thing is palm chewing, smoking. All this causes cancerous lesion in the mouth. So
Oral
they have,
cancer.
yeah, oral cancer. So they need to quit the habit, or early diagnosis would be better. Third thing is sharp tooth. There will
Okay.
be chronic irritation on the cheek or your soft tissues. That has to be grinded. Very, very important. And last would be your wisdom tooth,
Okay. Okay.
cheek bite, all these things.
Okay. We have one more question that's coming from our attendees. Abhishek Ghosh, the question is, what is the typical fees for BDS and MDS course in India? Typical fee for a BDS and a MDS course in
in
India.
colleges, right?
Yeah.
Yeah, it ranges between 5 to 10.
For MDS also it's the same?
MDs, it will be depending on the department.
Okay. So in MDS, do students have different specializations that they can choose from?
Yes, there are 9 departments. They
Okay.
can there is clinical and non-clinical also. Accordingly, the fees differs.
Okay, okay. So all the colleges have BDS and MDS courses, all the dental colleges,
Most of the colleges, yes.
most of the colleges. Okay, yeah. So if somebody is willing to pursue MDS, should they do it right after their BDS or should they gain some work experience and then later do their MDS? What
Not
would you
necessary.
suggest?
They have to give NEET
Again.
exam again, and then apply. You don't have to wait.
Okay, okay. So you're saying you don't have to wait till you gain a lot of work experience. You can do it right after your BDS also.
Yes.
So MDS is a 2-year course.
3-year course.
3 years. So it is a total of 5-year BDS and 3 years of MDS,
Correct. Yeah.
which is a 8-year course. If somebody is looking at BDS plus MDS, then you would have to spend 8 years altogether for the course completion.
Yeah.
After MDS, do they have to go through any internship or like BDS, or do they have to apply for jobs?
They can directly apply for jobs, or they can start as a consultant. They can visit multiple clinics, or they can start their own practice.
Okay, okay. Okay. Thank you so much, Dr. Lakshmi Prabha. I hope all your questions are answered. With this, we are coming to the end of